With respect to treatment for PTSD, one of the things that we know works really well is helping the individual to confront rather than avoid their traumatic memory. So the services that work to treat PTSD often involve the therapist working with the client to revisit the traumatic memory in their imagination, so that over time they become more comfortable with it and they can put the memory in context or look at the traumatic event in a different way than they have been. And the virtual reality technology basically helps us to do that. A traumatic event, it might be impossible or dangerous for someone to go back and confront that. So we have them confront it in their memory instead. And so that's part of what the virtual environment allows us to do, is to be able to provide a way for them to safely confront the memory without going back into the traumatic situation. The OSI Clinic is a specialized tertiary clinic at the Royal Ottawa Mental Health Centre. So our mandate at the clinic is to provide a full range of services, assessment and treatment for Canadian Forces members who've released, as well as RCMP members. So we provide assessment of psychological injuries that are related to service and a broad spectrum of treatment services.
Fear, which is internalized, which is very difficult to control. So it often would feel that letting somebody else know about this, or even, remembering some fearful aspects of past events, may damage you, may scare you even more, may cause even more problems. So people would, for reasons that feel valid at the time, they hide it away.
There are services out there for PTSD. What we want there to be more of is disseminating the treatments that work for PTSD. So there are various approaches to treating all mental illnesses, some of which work really well and some of which don't. And there are services for PTSD that work really well. So PTSD, although it's a severe illness, is a very treatable illness, provided that people are getting the treatments that work. So part of what we need to do is to help disseminate those treatments and make them more available to the people who need them. And on the flip side, we also need to work to reduce some of the stigma around mental illness so that people who have these symptoms feel more comfortable coming forward and asking for the help that is available.